Hello. Today I'm going to be talking about Marfan syndrome. So what is Marfan syndrome? Marfan syndrome is one of the most common inherited genetic disorders that affects the connective tissue. The disorder is believed to affect 1 in every 5,000 to 10,000 individuals worldwide. It is a mutation caused by the FBN1 gene on chromosome 15. The mutation affects the amount of protein called fibrin produced, which affects tissue growth and elasticity. This condition can be life-threatening depending on the severity, but in some cases can be very mild or minor. The general symptoms of this disorder include tall and slim physique, disproportionately long fingers, hands, and toes, scoliosis, heart murmurs, severe nearsightedness, flat feet, flexible joints, and crowded teeth. Marfan syndrome is caused by a mutation. Fibrin is responsible for the body's connective tissue and regulates tissue growth. The defective gene reduces the amount of fibrin produced, which affects the strength in the connective tissues like the tendons or ligaments, because there will be less tissue growth and elasticity. That will lead to several symptoms I stated before. Marfan syndrome does not affect a specific ethnic group or gender, rather it's random depending on your parents' genes and family history or random mutations. These models represent the inheritance and genetic length of Marfan syndrome. As shown in the first model, Marfan syndrome has an autosomal dominant pattern. This means if you receive one copy of the abnormal dominant gene from only one affected parent, you can still inherit the disease. The model shows how if only one parent has a copy of the mutated genes, they will have a 50% chance of passing it on to their offspring. The second model represents the process of meiosis during different scenarios, one with an affected parent and one without, and how that would affect their sex cells. The next 4 models show the different possibilities that could occur to the offspring depending on the altered gene. The first model shows an unaffected offspring because there is no copy of the mutated gene. The next model shows a scenario in which the mother has a copy of the mutated gene and the father does not. In this case, the child would inherit the disorder and have a 50% chance of passing it on to their children. Model 3 shows the same thing except the roles reversed, with the father being affected and the mother not being affected. Model 4 showcases a scenario in which both parents have a copy of the mutated genes. In this case, the child will have the disorder and will most likely or will pass it on to its offspring. So, what are the cures? Marfan syndrome is an inherited syndrome that you are born with. Therefore, there is no cure, yet it can be managed. In order to slow down effects or prevent risks, medicines, surgery, and physical therapy can be taken. Lifestyle choices can also delay the effects of the disorder. Individuals who suffer from Marfan syndrome are usually advised not to engage in either competitive sports or intense exercise. The treatment that is taken all just depends on the severity or minority of the diagnosis and the patient's personal symptoms, since Marfan syndrome affects more than just one body part. Depending on the treatment and regular checkups, a patient can live a normal lifespan. So can parents who have a child that has Marfan syndrome produce more children without the disorder? Yes. They have a 50% chance of producing children who do not have Marfan syndrome. The model above shows how if only one parent has a copy of the mutated gene, they will have a 50% chance of passing it on to their offspring. So there is also a 50% chance that it may not be passed down to an individual sibling. Around 70% of the time, Marfan syndrome patients inherit the disorder from their parents, while 25% of the time, individuals inherit the disorder from a random mutation in the sperm cell or the egg cell, either one of the sex cells. Sex cells are produced through the process called meiosis, in which cell division occurs, which splits the number of chromosomes in half. There are several factors of meiosis, therefore there is a variety of possibilities for the mutated genes. If an individual receives one copy of the abnormal dominant gene, they will inherit the disorder and have a 50% chance of passing it down to the gene off to their offspring. If both parents possess one copy of the altered gene, then the child will have Marfan syndrome. Random mutations in the cell can occur, and they usually take place during DNA replication. Thank you for listening.